My name is Leanna Worley. I was diagnosed with first thoracic outlet syndrome, which led to a surgery to remove my first rib from my neck area up here. That was in 2017. After that, well, during that surgery, my phrenic nerve was damaged and caused me to have a paralyzed diaphragm.
Quick teaching moment. Here is the definition of your phrenic nerve and how important it is to your body.
The way that they diagnosed the diaphragm paralysis was on my CAT scan report as a possible right hemidiaphragm paralysis. You have two diaphragms, or it's like one, so there's one from each side of your lung. So my right was damaged, well, not working, paralyzed, and the left one still worked fine. There's a picture that you should have seen that shows you my lung. So the first thing is the image. It was a chest x-ray and then the CAT scan, and then also right after the surgery I had a pleural effusion, which they resolved that with a chest tube for a few days. And I still had a lot of shortness of breath, tightness in my chest, a heavy weight in my chest from all of that right after the thoracic outlet surgery, which they called it a, I'll put the name down here somewhere of that. Gotta look it up. Yeah. So many medical terms, so many rare issues that I had over the last few years. The pain was so unbearable that I literally prayed for God to let me die. My pain management just wasn't great at that time, but once they realized what was going on, everything went better after that. I was told that there was nothing we could do about my diaphragm paralysis, being as though it was one side. There was nothing that they could do or would do. So I went to the internet and I found out about Dr. Matthew Kaufman is the way you say it in New Jersey, and had a phone consult with him, and he went over all the risks, the advantages of having the surgery with him. But part of it was a right phrenic nerve transplant. So they take a nerve from your leg, from the calf of your leg, the back of your leg. The incision is about that long, and he did basically was like a heart bypass in my neck, and to give me a stronger chance of that working, he did two. He cut in that same area where I had the rib removed, and he went above, so he went to the good area of my phrenic nerve and to the below the bad area, and created two grafts. So after that surgery I felt a little bit better. I had a drain, a JP drain, so Jackson Pratt drain, and yeah, I had to go to Jersey from Tennessee up to Baltimore, then to New Jersey. Before you see Dr. Kaufman, you have a nerve conduction study. During that study, it is painful, but the doctor at that hospital is phenomenal. They stick like a long needle, I guess like, what do you call it, acupuncture type needles, kind of. They stick a long needle into that diaphragm area, into the nerve area, and then they stick one in your diaphragm, long, and then they send pulse, like electrical pulses to it, and if it reacts, then you don't need the surgery. However, mine was not reacting whatsoever, so I had the nerve graft done.
And here is an example of a nerve graft for those who need a visual reference.
3 days later, after staying in the hotel, I stayed in the hospital one night, then went to the hotel, recuperated there for a few days. Saw Dr. Kaufman after the surgery. They removed the drain, and unfortunately over the next couple of weeks I started getting a seroma that built up, and I started realizing shortness of breath again, and that may have caused some damage. However, I still was a lot better than I was before. So what Dr. Kaufman likes to do is wait. I think it was about 12 months later, around maybe not even 12 months, because I had the surgery in December. The first rib removal was April. Dr. Kaufman in December of 2017. In September, I reached out to him and he said, let's give it like 6 more months or so. So of course I called back. I had a sniff test. That's the other way that they diagnose your diaphragm. You have to go into an x-ray machine with a radiologist standing right there with you. And they tell you to literally sniff. And you can see the diaphragm contract or move. If your diaphragm is paralyzed, it will stay. In other words, when you sniff in, it should go down. My good side would do what it's supposed to do, whereas though my right side just, it basically, instead of going down, it went up. So it's more so restricting airway, restricting my lung capacity. Here's Izzy, interrupting the shoot. Hey baby, no leg. We're on a commercial break. I just want to shout out Lamar Jackson, Baltimore Ravens, because we're originally from B-More, okay? Yes. All right, so hopefully she's finished. So we also discussed having the diaphragm pacemaker placed, and so it was if he gets in there and things look promising, then we can go for the pacemaker to help wake the diaphragm up. If things don't look promising, then we'll go with the diaphragm plication. The plication involves stitching the diaphragm to itself, because they couldn't just stitch it to my liver, because my liver and my colon were up in my chest. Because when the diaphragm is paralyzed, everything shifts up on whichever side it is. So many risks, probably about 10 pages of risk that he goes over with you. You go into that surgery well informed. He's very thorough, great bedside manner. So when I went up there, same thing, had to have the nerve conduction study again. He will not operate on you unless he has that first. So you get the nerve conduction study done. I went in there, same doctor. They remembered me from the year before, and they remembered no activity. So he did the nerve conduction study test, and my nerves showed some reaction, which was great. So that meant that the surgery from the previous year with Dr. Kaufman actually worked. It just took some time. However, the diaphragm was asleep or dead. The diaphragm is a muscle, so it hasn't been used in 18 months at that time. So the pacemaker was the option that we went with to wake up the diaphragm. Since you've seen a picture, when I first had this happen to me, diaphragm was way up. Now I only had like 4 or 5 ribs you could see on x-ray. Now you can see 7. It's just a little off, just a little. So much better. I feel much better. I'm still a little tacky, meaning like a high heart rate. It's not as bad as it was. I could go up a flight of steps now, and I think I'm around 110, 120, whereas before it was 120 to close to 140. So much better than how I started out. So the pacemaker is on. I have it in my little fanny pack. If you watched the video from what I have to do to bathe, then you'll see how all of this works. So this is on, plugged up, and it's attached to my the port in my abdomen. I will have this for 1 to 2 years, and as good as I am doing right now, I am hopeful that maybe I can get it removed later this year, if not next year. So goal is 1 to 2 years. I'm pretty sure I'm doing pretty good to be on track for max 2 years. I've had x-rays with and without the pacemaker on just November, and it looked very good compared to before. Please like, comment, and subscribe to my channel. Ask any questions that you have, ask away, and I'll try to answer them to the best of my ability. This is in no way giving you medical advice. It's just giving you the information of what I went through. So you must consult your own physician and make your own medical decisions. Definitely advocate for yourself. This experience has taught me a lot, and I've gone through a lot of psychological therapy because it's traumatic. I'm 42, almost 43 years old this year, and to have this happen at age 40 has been tough. However, resilient, faith, a great family support system, and counseling. Great counseling, I will say. So if there's anything else you want to know, just let me know.